Good morning. Welcome to today's virtual roundtable brought to you by the Bay Area Manufacturers Association and the Manufacturing Supply Chain Alliance in conjunction with Florida Makes. I'm your moderator, Beth Gallick, and we're about 5 minutes from the start of our program. Today, you'll get the chance to hear from manufacturing professionals in the Tampa Bay area. The panel consists of Cliff Sulik of Jabil, Angie Ruff of Compass Blending, Jeff Rogers of Bausch & Lomb, and Jonathan Zern of Translogistics. Today is April 10th, 2020, and we will start at 11:30 a.m. Eastern. As a participant, your audio will be in listen-only mode using your phone or computer. During the webinar, there's an opportunity to ask your questions using the question window. Add your questions there and we'll address those as time allows. This is a live webinar event which will be recorded. A link to the recording will be provided to you within a few days, and the broadcast will be starting in a few minutes. Good afternoon and welcome to the Virtual Manufacturers Roundtable, How Has COVID-19 Affected Your Business? Hosted by BAMA, the Manufacturing Supply Chain Alliance, and Florida Makes. Today is April 10th, 2020. Thank you for joining us today. I'm Beth Gallick, Executive Director of the Bay Area Manufacturers Association. This webinar is made possible thanks to the Florida Makes Network. The Florida Makes mission is to improve the productivity and technological performance of Florida's manufacturing sector. The Florida Makes Network is an industry-led initiative operated by Florida's regional manufacturers associations in partnership with industry, research, educational, and economic development organizations, both public and private, at state and the national levels. The network provides services focused on three principal value streams: technology adoption, talent development, and business growth. BAMA, your host for today's webinar, is proud to be part of the Florida Makes Network. We support manufacturers and promote economic development in the Tampa Bay region. Our upcoming webinars are April 15th, we have a virtual event helping your employees cope now and prepare for the future. And on April 17th, how to keep your employees safe during the COVID-19 pandemic. As a participant, your audio will be in listen-only mode using your phone or computer. There's an opportunity for you to ask your questions to our panel using the question window. Add your questions there for our panelists. This is a live webinar event which will be recorded. A link to the recording will be provided to you within a few days. Today's presentation, Virtual Manufacturers Roundtable, How has COVID-19 affected your business? And I would like to introduce today's panel. First on the panel is Cliff Sulek of Jabil. He has been a member of BAMA for 11 years and on the board of directors since 2010. He served as the BAMA president for 4 years from 2012 to 2015. He graduated from Toledo University with a BS in mechanical engineering and has worked for Jabil for 20 years. Cliff started out at Jabil as a manufacturing supervisor, and other positions have included manufacturing manager, production control manager, and business unit manager. His current position is Global Operations Development Manager with Jabil. Angie Ruff is the CEO of Compass Blending, LLC, Yum Distribution, LLC, and Copac Solutions, LLC. Angie is frequently seen at the helm of these companies, but is also found on the front lines of production. She has 21 years of food manufacturing operations and management experience. Angie's expertise in the dry food industry includes manufacturing, branding, and distribution, with education as an engineer and a business degree that strengthens her hands-on experience. Not only is Angie a successful multi-business owner, but she's also a single mom, and she makes time to give back to her community, working with various local organizations. Jeff Rogers is the Environmental Health and Safety Security Manager at Bausch & Lomb, Tampa. He has 13 years of environmental health and safety industry experience, 8 years in pharmaceutical manufacturing, 5 years in EHS consulting, and a master's and a bachelor's in chemical engineering. His area of expertise is hygiene risk assessment, Lean Six Sigma process involvement, environmental and remediation system design, environmental, health and safety compliance, business continuity and contingency planning, and ISO certifications. And last but not least is Jonathan Zern of Translogistics. He's an experienced sales and operations professional who has had the privilege of working with corporations and school districts across North America by offering various software as a service solutions to increase the overall efficiency of their operations. He's a firm believer in the consultative approach with a strong focus on relationships built with mutual respect and trust. Translogistics is a third-party logistics provider for companies who manufacture and distribute goods. Now, Cliff will kick off today's event with what Jabil is doing to manage the pandemic from the human element and how they ensure the health of their employees. So Cliff, please take it away.
Thanks, Beth. Good morning, everyone. Thanks for joining us this morning for this webinar. Hope you're all staying healthy and safe in these challenging times. So as Beth mentioned, I'll go through what Jabil is doing more on the human side of the aspect of this pandemic. So you can go to the next slide there, Beth. So obviously, Jabil's a global company. You know, we've got 200,000 plus employees. So you know, with that size of a company, communication can become a little bit of a hindrance with so many different plants and so many different people around the world. So As I mentioned, the health of our employees and the well-being of our employees was our first priority. So, some of the first things that we did when this pandemic broke out, or even when we started hearing about it in China, is we suspended all travel for our employees, and we also suspended all visitors to our plants. And then we also had, if you're not directly supporting a plant and you don't need to be in the manufacturing plant, then you would work remotely. So those are a couple of the first few things that we did just to minimize, the exposure that people could have to this pandemic. And then in the following slides here, I'll talk about some more things that we did. You can go to the next slide there, Beth. So we'll talk about some of the what we're doing for the workforce, some of the travel restrictions, like I just mentioned. We'll talk about some of the customer needs and what we're doing on the supply side and the logistics side as well. You can go to the next slide. So again, with the amount of folks that we have in Jabil, communication is key. So not only are we managing it at the site level, but we're also discussing and meeting at the regional level as well as the global level, and then the executives are also getting a roll up of all of that information. So and it's just not the plants, right? We have multiple groups within the company, whether it would be the operations side, the business side, our logistics teams, our supply chain folks, our health and safety folks, our finance folks. So, we have a broad band of people that are involved in daily calls at the site level, at the regional level, and the global level to kind of ensure that we're all on the same page, that we're all presenting the same message to our people. And also rolling out the protocols for this pandemic, so that way all the plants are doing the same thing, and that we're also learning from other plants. Some plants come up with some best practices, then we want to roll that out to other plants as well. So go ahead to the next slide, Beth. Obviously, to mitigate the risk, coordination is key. Jabil being a large company, we have a lot of resources. So we developed a web dashboard to kind of summarize all the information that we're gathering at the site level and at the regional level and then at the global level. So, we're monitoring the health of the employees at each of the sites. Like I said, we're sharing best practices. We're getting updates from the different governments around the world. If they've enacted curfews or similar to things here in the States, the stay-at-home initiatives. So we talk about that and we roll all that up at the global level, and then we're also tracking anything to do with supply chain and logistics and the needs that we need for the plants. Go to the next slide there. This dashboard that we created internally, like I said, you can get updates on, the health of each plant, what the government updates are for that region or for that state. If there's any travel restrictions, which we've already implemented, any supply chain issues. So again, that way all the way up to our executive level, they can get a broad scope of the impact, not only to our people, but what's going on in terms of our daily lives and the daily business. Go ahead, next slide. So we developed, some protocols and processes working with, working with our EHS departments, with local health agencies and local governments. So we, combined all of that to come up with different protocols. Obviously, just like you hear here, right? Personal hygiene and protection is key. Washing your hands, not touching your face, all that kind of stuff. So we continuously preach that message to our employees, make sure that we're practicing that not only in our plants, but also at home. When people show up to the sites, they go through a screening. We take temperatures, making sure nobody has any type of fever, make sure they're having no type of symptoms that are common to the COVID-19. If they do, then we don't let them in the building, and they have to go and seek medical help to assess if they have anything other than just a common cold. Anything from a respiratory standpoint, we're also wearing masks in the plants to prevent any type of spreading of any viruses there. Go ahead to the next slide there. Again, this is just a kind of a picture there that, and an entrance at a plant where they're taking temperature readings of the employees, making sure they're having, no health issues there. We practice the social distancing in the plants as well. We've adjusted people's break times and lunch times, and in the cafeterias, we spread out tables, just to try to keep that. If there's doors, in common hallways or whatever, we've opened those up, so people don't have to touch the doors and continuously open and close them. So we just try to minimize anything that we can to try to do that. And I know, an interesting fact I saw was this Publix just recently went to, one-way aisles, which I thought was pretty cool, and try to help the flow of the people to keep the social distancing. And if you go to like Home Depot or Lowe's or any of those places now, they actually have places on the floor marked off on where to stand to try to keep your social distancing. So we've adapted some of those as well in our plants, just to try to help people remember where to stand or where to walk. And then we also we have our business continuity plans for any time there's any time of any type of disruption in our business, whether it would be, a natural disaster such as a fire or even a hurricane. And this pandemic, kind of qualifies as that. So, we go through our business continuity plans. If there was a disruption, what would we do? How will we minimize that risk to our customers and minimize their exposure? Go ahead to the next slide, Beth. From a supply chain, obviously with China, being shut down for a period of time, that was, the world is feeling that effect, and we're no different. But, so we're continuously working with our suppliers and our vendors to get updates, to track critical components, working with, with our logistics and our carriers to make sure that we're getting priority, not only on orders within our vendors, but also, if there's a shipment, whether that would be by air or boat or something like that, we try to work with them so we get priority of that stuff. Go ahead to the next slide. Again, this is just some notes here on reducing the supply chain disruption. Being a large company, we've got a lot of supply chain folks, our commodity managers and our experts. They're obviously looking at the supply chain, not only regionally and at the sites, but also globally. Where can we leverage each other plants? If we have some commonality in parts, maybe we can share some parts if it's the same manufacturing part number. How do we, is there a way we can work with the vendors to pull orders ahead? Or if there's any critical ones, how do we focus on the critical ones and kind of put the other ones off to the side if needed? Go ahead to the next slide. And again, the communication is key, especially in large corporations like Jabil. So, we have, like I said, we have daily calls with the sites, we have daily calls at the regional and the global levels. We had that dashboard created to try to keep everybody on the same page. Our corporate marketing team has, created a bunch of literature and flyers and stuff to post in the plants and online of just good hygiene practices, and try to tell our employees to stay off of social media. That's the worst place you can go, to get your information, because it'll just drive you crazy. Get real, you can get antsy, and so just try to focus on what we're telling you in the plant. We're trying to make the plants as safe as we can. And then obviously just limit your exposure outside of the plants, only going to the places that you essentially need to go to. And that's, how we can minimize their exposure. Go to the next slide. Okay, and this is just all about teamwork, right? I mean, whether you're a large company or small company, we're all in this together. And that's the only way we're going to get through it. You've heard the saying, these are tough times, but people are tougher, right? The people are going to last longer. So, we just got to continue working together, sharing best practices where we can, make sure we're all aligned. We're all communicating the same message to the employees, and if the employees have issues or if they have concerns, then bring those up, and we address those and how we can improve. They've had great suggestions on how to improve any social distancing within the plants, and so we listen to that and we enact that kind of stuff, and then we share that across all the different sites. Is there another slide after that one, Beth?
Nope, that's the end. So thank you, Cliff, for sharing that with us. We appreciate it. That will be made available. It is in a PDF form on GoToWebinar, and it will also be made available through the presentation will be available on the Florida Makes YouTube channel. So now I would like to open it up to our panel. We do have some questions that we have prepared. If you have additional questions, please add those to the question bar, and you can just type those questions in and we'll read those off as time allows. So for our first question, and we'll go to Angie, how has this pandemic affected your business?
Thank you again, Beth, for the opportunity to be part of the panel. So with regards to how the pandemic has affected our business, we've seen a serious decline being a food manufacturer in the retail and food service sectors, while places such as cruise ships, restaurants, other types of tourism-based food needs have significantly declined. That has been probably the biggest, but where we did not anticipate is we've seen an increase in our industrial customers, because there's more of a need for items within snack food and things of that nature.
Thank you. Jeff, would you like to comment?
Yeah, absolutely. And again, thank you for having this discussion. I think it's very prudent and makes a lot of sense to work together to address these issues. But as far as our business, we're a pharmaceutical manufacturer, and we've been fortunate to be part of the the essential business list. So we've been able to maintain operations, but that does not mean we haven't been impacted. The international travel ban has impacted our business. We have some manufacturers of equipment abroad. So as far as site improvements go, we have not been able to get some of that equipment to the site. So it's certainly delayed some projects. It's hurt our site from our employees' perspective. We can't have some of the robust healthcare programs that we've had in the past. We have yoga programs on site, food catering services, lunch and learns and massages that are no longer permitted on site because we can't have visitors. So minimal things like that. But I could see this long term having a more significant impact. Being a global company and having a global supply chain, the longer countries are down and longer manufacturing's not being performed, it's going to certainly impact our supply chain. So
Okay, thank you, Jeff. Jonathan, would you like to comment?
Certainly, Beth. Thank you very much. It's a pleasure to be here. Appreciate the discussion, as Jeff mentioned. The pandemic for translogistics has been, I would say overall, it's had a minimal impact on our business, depending on where the manufacturer distributor we work with is based or where they have plants. Largely, we've been, our customers have been pretty well able to make it through the first month of this, and we anticipate things getting a little bit better. But we've had some companies where maybe they're project-based companies, and the projects right now for construction projects, what have you, those projects are on hold temporarily in some cases. But we have other manufacturers, maybe a large pharma packager, they're producing more pharmaceutical packaging as a result of what's happened. So on the whole, our business, and by proxy, our manufacturers we work with, has been largely unaffected to this point.
Okay, thank you. And Cliff, would you like to comment?
What I can comment, I can't comment on the financial aspects, but what I can comment on, obviously, like I said, is, you know, the human impact. And I know one thing we talked about was how do you maintain well-being with this too, right? And some of our teams have actually started having like a virtual social gathering on Fridays where, you know, at 5 o'clock, 5:30, you know, their teams would get on, get on to Teams or Zoom and just have like a virtual social hour, just so they can, just sit back and still talk about the week and even have a drink while they're doing their virtual hour. So that's one way they've been trying to keep some of their sanity, if you will, during all of this. And the other thing I can say is, at least from a Jabil perspective, is, for us, back in, if you remember back in, 2000 when we had the tech bubble, and then 2008, 2009, a lot of businesses, suffered during that time. And from a Jabil perspective, we were no different. But what we've done over the last, 10 years is really diversified our portfolio. So, we're just not into, whether it be just consumer electronics, we're in the healthcare business, we're in the packaging business, we're in the defense and aerospace business. So, across the multiple sectors that we have, when we have some type of, issue like we're having now, hopefully, if one area of that business takes a hit, then the other areas can pick it up, right? So, hopefully through our diversification of our portfolio, that the impact will be minimal, if any, to us. But that'll be foreseen here in the next quarter or so.
Thank you, Cliff. And we talked about how your businesses have been affected. Are there any other things that you're doing to offset the effect? So starting again with Angie.
Absolutely. So we're basically just pivoting as where and best we can, looking at other opportunities that perhaps we would not have looked at in other areas, such as packaging foods for MRE style items with regards to school lunches. That's something we would not have done otherwise, because it would have been a traditional school lunch in the past. So truly, that's one thing as far as the economic offset. And then, much to everyone else, and I know we'll cover it in other questions, focusing on really building a team and supporting all the individuals on our team so that the work that has to get done is still done.
Thank you, Angie. Jeff?
Yeah, thank you. So, yeah, I mean, it's a challenge, obviously, but we don't know necessarily what tomorrow will bring, but planning is so critical. So, I think from the governor and the mayor, if you pay attention to what their communications are, they're really broadcasting, what the next steps are, what the CDC is going to do next. So understanding that, anticipating that allows us to make changes and allows us to plan around that. So our contingency planning, these discussions happen routinely. So we try and plan the best we can for, to offset some of these effects. If some projects are delayed, resources will be taken from those projects and put onto other projects, things will be pulled up instead of being on the back burner. So it's a challenging. I think everybody's got to be flexible and just adjust.
Thank you, Jeff. And Jonathan?
Yes, thank you, Beth. Besides the fact that from a company perspective to offset the effect, we've looked in other areas to help manufacturers, for example, manufacturers that are producing a PPE or other products that they don't typically produce. So we're helping them get those products to where they need to go, where that would not be the norm for our business. But we've also, and Cliff alluded to this and others have talked about this, the personal element of this, we're increasing our level of empathy for our employees as well as the employees at the manufacturers that we talk to and deal with on a regular basis, and many of them have known us for a long time. We're trying to be even more empathetic before we get to the business side of things when we have those conversations with our employees and also with our customers, our manufacturers.
Thank you. And Cliff, do you have anything additional to add?
No, I don't have anything additional to add. I mean, like I said, I can't talk about the financial piece or the business piece of it, but everything that Jeff and Angie and Jonathan said are, in line with things that we're also doing from a human element.
Okay, thank you, Cliff. And what protocols have you put on the factory floor? What are some creative ways you're meeting the safety guidelines? I know Cliff had discussed that in his presentation. Angie, would you like to comment?
Absolutely. So we are doing daily health checks with all of our employees. Our quality department is monitoring temperature and then any potential symptoms of anyone on the floor. And we're actually doing that 3 times a day. We're also increasing distance between production lines, and we've changed our schedule to limit people in areas of common gatherings such as lockers, break rooms, including, even putting occupancy limits on certain rooms where it wouldn't have been quite as limited prior. And then visitors, there's absolutely no visitors allowed to the building, and drivers are to remain in their cabs, and appointments are being made. And of course, if it can be done virtually like we're doing today, we're doing everything as virtual as possible.
Okay, wonderful. Jeff?
Yeah, so there are so many things we're doing on the factory floor. We couldn't possibly talk about them all on this call. I will say, with a company, a global company like ours, 30 plus sites, we've brought all the sites together. We communicate regularly on these, and they've come up with some pretty innovative stuff that really a lot of the sites haven't thought about. So we're sharing best practices, and if you guys have the opportunity to do that, I think it's a really good way to go forward. Some of the things we've done, like in the cafeteria, we've spread apart people, but we've also implemented a disinfection program. We put cards on the table, red, green cards. So if somebody uses a table, they flip it to red, so they know that it shouldn't sit there after it was used before it's disinfected. So some other things, spacing people out, using yellow tape on the grounds, spread them out 6 feet. All those exposure prevention actions are critical. But also, on the other side, communication is critical too. So much of this prevention activities are related to social behavior, and keeping people away from each other is really a behavioral issue. So from a safety perspective, that's my biggest challenge is, modifying people's behavior to think, to protect themselves. So, constant communication, constant reinforcement, positive reinforcement. We've implemented a program where we see people standing 6 feet apart. We give them encouragement. We have an internal program to give them cards or incentives. So, try and get that positive reinforcement. But, again, the social distancing is the biggest challenge for us right now.
Okay, thank you for sharing. Jonathan?
Nothing to add for me, as we would not, necessarily apply to this particular question, and a lot of what has been spoken of, we've done from an office environment perspective.
Okay.
So there's nothing to add.
Okay. And Cliff, did you have anything additional?
The only thing I would say is Jeff kind of highlighted it, is just the social distancing. I mean, that's definitely presented some challenges just because, in the manufacturing world, it's, speed is timely and key to resolving issues. So, we tried to minimize the amount of people going to the production floor every day to limit their exposure to different people. So, having production meetings on the floor, but now having them virtually at everybody's desks, presents a whole new different way of doing things and presents some challenges. But but it's in the best interest of, trying to limit the amount of exposure the folks on the production floor have every day. So yeah, it's definitely different and presents some new challenges for the way you communicate.
Okay. And is there anything that you would like to do that you are not able to do? And I'll start with Angie.
I think for us, I mean, we've pretty much adjusted. It's not necessarily would like to do, but we understand the needs currently to flatten the curve and do our part. But I do wish that there was a better availability of a network to be able to get items that we potentially can make or support to healthcare industries or government agencies that need those. So that to me is something that I wish we had the ability to do in a better fashion at this time.
Okay. And Jeff?
So we've been pretty fortunate to have a pretty robust procurement team who recognized the hazards and jumped on it and was able to purchase supplies right away. The only thing I wish we could do is be able to provide our employees protection that they can use while they're not at work. The CDC recommends face covers, and we would really like to provide them those covers so they can use them outside of work. And also, possibility of maybe having hand sanitizer that they could take with them to use at home and outside of work. So I think our employees are well protected at work, but the concern is really their exposure when they leave here.
Okay, great. And Jonathan?
Thank you, Beth. I would say from a collaboration standpoint, from a team standpoint, what we're not able to do and what a lot of our manufacturers tell us they're not able to do is sit around maybe the picnic table, have a discussion, sit around the cafeteria tables and just get to know each other as coworkers, talk about policy, talk about protocol, talk about what we're doing for the next month and so on. You're missing out on a lot of that right now. So that would be something that, we Translogistics would be wanting to do a lot more of, and I know our manufacturers feel the same way.
Okay. And Cliff?
Yeah, I think I would just expand on what Jeff had said. I mean, trying to ensure the employees' health once they leave, the plant, whether that would be able to provide them, with PPE wear, that kind of stuff. So, that's kind of hard to get a hold of these days. So it'd be nice if we were able to do that for the public more.
Okay, wonderful. And I would like to take this time to mention that we do have a Connects Florida is a statewide manufacturing supply chain and workforce and R&D connection solution. So that was just launched Wednesday. So we are creating a database. If you would like more information, please contact Florida Makes or BAMA. And we can get you in touch with how to get involved with that database so that we can connect those manufacturers with the companies that need those resources. So if you would like more information, that will be sent out to you following the webinar in an email. So you'll receive more information on that. So that will be a good solution for you, Angie, on what you had mentioned.
Fantastic, thank you.
You're welcome. And are there any supplies or needs that you're unable to get? Or are you having any trouble in that aspect?
With that, I would say for us, because we are a dry food manufacturer, we already used N95 masks to start with as part of our normal PPE. So with the need and the short supply, obviously trying to determine who needs those the most, that has probably been our biggest challenge is regards to that type of PPE. Anything else, everything else we've been able to be very resourceful, fortunately, with a fantastic team that we've got on our staff to find everything else. That's been our biggest challenge.
Okay. And Jeff?
Right now, we're having a challenge finding pre-wetted disinfectant wipes, like Lysol wipes or Clorox wipes. So we've had to use paper towel and disinfectant spray, but so we have a substitute, but that's really the one challenge we're looking for. Surgical masks too, those are a challenge. We've kind of held off on buying some of them so that hospitals and other medical industries could purchase them, but that's the one thing we are missing.
Okay. Jonathan?
Nothing to add on this one.
Okay, and Cliff?
No, there's no other supplies that we need, and we've been fortunate just because of our large network of not only vendors but all of our other plants. You know, we share amongst ourselves if there's a need, so we've been able to to do that if needed at any time.
Okay, and now focusing on your employees and workforce. Have any of you made the difficult decision of laying off portions of your workforce during this time? Angie?
Fortunately, we have not had to do that at this time.
Okay, great news. Jeff?
There's been no impact to our workforce at this time as far as hiring or firing. We are actually still hiring people, so if you have any people looking for a job, you can go to boschhealth.com/careers.
Okay, wonderful. That's great news. Jonathan?
We have not had to lay off any employees. In fact, our leadership has been very upfront with us, weekly 2-minute recordings just talking about the various lever plans that could be enacted if things were to go a certain direction. So they've been very upfront with the team, but we've not had to lay off any employees.
Okay, that's good news. And Cliff?
Yeah, this is more of a financial question, so I'll defer on those since we're prohibited from talking about financials.
Okay, absolutely. And are you all, and I know some of you spoke about it, monitoring the health of your employees? Angie?
Yes, we are. We take biochecks basically at the beginning of shift, mid-shift, and at the end of the day. And then we also have them self-certify.
Okay. And Jeff?
No comment on this one. Thank you.
Okay. Jonathan?
Since we're not in a manufacturing environment and all of our office staff are now remote, this wouldn't apply to us at this time.
Okay. And I think Cliff spoke on this. Do you have anything additional to add?
No, I don't have anything additional other than what I've already discussed, so I think we're good there.
Okay, and I know we brought up some ideas on how to handle and maintain a positive morale during these times. If we can go through and talk about any additional ways that you are maintaining the positive morale. Angie?
Well, we actually had to get pretty creative with during the positive morale part. We've done distancing, physical distancing potlucks. We actually had one of our shift leads whose baby shower was canceled, and so we threw her a very distanced baby shower in the plant. So I'm really just trying to make it fun, and when they're at work, we focus on work and keep it lighthearted and there. But then for all of our remote employees, we're doing weekly one-on-ones with everyone. We're encouraging people to have accountability partners where they're checking on one another as well. So lots of daily updates from supervisors, leaders, and line leads, just to kind of make sure everybody's just happy. That's really about it.
Okay, wonderful. And how do you feel that your employees are managing?
With that, I think it's, everybody has a different situation at home. Some people have children that they're trying to do their virtual learning at home, and others are, we're encouraging, I believe Cliff had mentioned, to limit social media and limit the intake of data, because when it all comes out, it's a little difficult. So we've only, had a few people that had made some concerns with regards to stress levels being at higher levels at this point in time. So I would say overall the majority of our employees are handling it very well, and those that aren't, we've worked very hard to help them manage their stress in whatever way we have available.
Okay, that's wonderful. And Jeff, how do you feel your employees are managing, and other ways that you're maintaining the positive morale?
Yeah, I think this one's challenging, right? We got a lot of news coming at us real quick, and it's a stressful situation. we are always looking for ways to improve. I really appreciate Angie sharing her methods of improving morale and reducing stress. I think our employees are doing well. We have a few here and there, especially those people that are at the higher risk. Those people have a little bit higher stress level, but we just address their situations with compassion, empathy. We're fortunate that our company, it does have a good sick leave program, and we have made exceptions for the COVID-19 cases. If they're sick, we're not, in any way, hurting their employment. We're making sure people who even feel ill at all are able to stay home, and we tell them it's okay. We're, reassuring their supervisors and making sure that message is out there. So I think we're doing okay. But as long as this thing continues on, we're going to have more and more creative ways to address the stress.
Right. Thank you, Jeff. And Jonathan, would you like to speak on this?
Yes, Beth, I would. We've been conscious about increasing the level of engagement with each employee. And to Jeff's point, there's a lot of information coming at a lot of folks at different times. So engagement may look different today compared to next Tuesday based on information people are getting, conversations they're having with neighbors or other colleagues. So increasing the level of engagement has been a top priority, having more phone calls, more virtual meetings, but also as best as we can with each employee, trying to vary schedules so one day doesn't necessarily feel like the next day. Again, remember, we're dealing with all virtual employees, so you don't want someone to go 1 or 2 or 3 days where maybe they feel alone or feel like it's just too hard to bear. So trying to change the schedule up in terms of when they're getting conversations with leadership and other colleagues.
Great, those are great ideas. Cliff, would you like to add anything?
Well, the only thing I'd add is, from our perspective, if people are working remotely, like I mentioned, we try to do some social virtual networking type of things with our teams. So that way they can still, stay connected as well as, not necessarily in the work environment, right? They can still socially talk virtually. So we try to do that for the remote employees. And then obviously, for the people working at the plants, it's just a daily communication, like I had talked about before. We're sharing the information on a daily basis with our employees, getting their feedback. If it's good feedback, good ideas on whether it's social distancing or other things, implementing those things, and so they can, the best thing we can do is make them at least feel safe and as safe as possible at work, and that we're taking all the necessary precautions to keep their health in check as well. So that's the key, at least the first key is at work, to try to do that and ease their anxiety that they may be having traveling back and forth to work.
Right, that's very important. Thank you, Cliff. Yeah. And how, as a manufacturer, how do you adapt when some of your vendors or your customers are partially or fully closed? Angie?
That's it. Well, I mean, at the beginning, I think anyone that's in supply chain knows never to put all your eggs in one basket. So, we're basically just reaching out to backup vendors and things of that nature when it comes to those types of situations. With regards to customers, I believe someone said it earlier, really just being empathetic with them. I can't tell you how many, actually, I personally called almost every single customer we have personally myself, and if I haven't, then their account representative has, and just basically just had a phone call with them. How are you doing? How are you doing? Not necessarily when's your next order coming or when's your next payment coming, any of that stuff. It's really just having that human aspect with it with regards to their situation and being sensitive to that. And then with our vendors, of course, we're also checking in. When do you think you'll be back and up and running? What's your situation? Just kind of navigating that, but in the meantime, of course, focusing on what we can have an impact on.
Okay, thank you for that, Angie. And Jeff?
No comment for me, thanks.
Okay, Jonathan, I'm sure this is right up your alley, so if you can give us your insight.
Yes, thank you, Beth. I really liked what Angie had to say in terms of empathy and engagement and really connecting on a personal level. That being the top priority, we take that stance as well. But for example, as you know, some manufacturers, whether it be in Florida, Pennsylvania, Michigan, what have you, have been closed or partially closed. You'll have situations where you may have raw materials inbound that are stuck in transit, or you may have materials leaving from Tennessee to go to Florida that have to be rerouted, or in some cases, we've seen situations where a manufacturer doesn't have the warehousing capability near their plant, and now they have increased demand, so they have increased maybe items coming near a customer or to their location. So we've been leaned on a little bit more to be more flexible with what we can do for them in terms of getting, you know, materials from point A to point B under these kind of unique circumstances. You might have a plant partially closed. They have to ramp up production somewhere else. So now you have a different supply chain aspect or a different supply chain challenge that these companies are facing as they're having to pivot, sometimes day by day, other times week by week.
Okay, absolutely. And Cliff?
Yeah, I think Angie hit it on the head there with, you know, just talk to your vendors and suppliers, right? See, not only from a human empathy standpoint, but, you know, how, you know, what issues are they having? What's their capacity, that type of stuff. If they are, you know, having issues, when do they foresee any of that stuff being resolved? And then that way you can make any contingency plans. And so that communication, you know, that with your suppliers and vendors is key, and that is continuous, you know, communication. You're continuously following up, especially in times like this. So that way you can risk mitigate as much as you can.
Okay, thank you, Cliff. And what steps could be taken with local and state legislators and leaders to be a resource to your customers? So I'll open that up if anyone would like to speak on that. Angie, is there anything you would like to comment?
Pass on that one, please.
Okay. And Jeff?
Oh, nothing to add on that.
Okay, Jonathan?
Yes, Beth, I would just like to say, from our perspective, as we partner with manufacturers, we look at it as our job to be their eyes and ears. So if there's any information we can obtain or be aware of related to county restrictions, state restrictions, state guidelines, county guidelines, even city guidelines that may impact one or more of their plants, depending on the state, depending on the county, et cetera, depending on the region of the country where the impact of the virus may be different. We look at ourselves as kind of a proactive arm of that manufacturer. So they're not finding out about it on the news or finding out about from their employees. We try to provide that information to them as often as we can, as opposed to them finding out about it reactively.
Okay, thank you, Jonathan. Cliff, do you have anything to add?
No, I don't have any additional comments. Thanks, Beth.
Okay, and I would like to mention that BAMA does have a resource page on our website where we do keep it updated as things come out. So that's a resource available for everyone to use. We're also keeping in touch with our mayors or senators. BAMA was represented on a call earlier this week with some of our legislators, just giving them the feedback of what's going on here in our area. So if there's anything you do need as far as you know, with your state and local legislators, please feel free to reach out to BAMA and let us know, and we'll make sure we pass that information on for you. Right now, I would like to open the floor and see if anyone has any additional closing comments. We'll start with Angie.
Again, I would just like to thank you, Beth, for putting this together and having us all part of this panel today. I think it's been very insightful and helpful to hear how everyone else is handling this and dealing with it. I think that's probably the most important thing I can contribute as a closing comment.
Thank you so much. And Jeff?
Yeah, hey, thanks again for having me on and being able to participate in this. I look forward to your future webinars and being able to participate in anything in the future too. So thank you.
Thank you, Jeff. And Jonathan?
Thank you to you, Beth. Thank you to the panelists. I appreciated being able to be a part of this discussion. And it's been neat as an American, as a member of a business, to see how Americans and businesses are coming together helping each other, providing for each other in forms like this, but also practically on a day-to-day level. It's been neat to be seeing this.
Thank you, Jonathan. Cliff?
Just thanks for putting this together, Beth, and thanks for the panelists and for everybody that's listening and attending the webinar. So hopefully these hopefully we gave some insights to them that'll help them take some good points back to their business and implement them there. But I think teamwork is the best thing, right? Not only within your own company, but even outside of your company with other manufacturers or other companies that support manufacturers, and how we can leverage each other's help and to get through this pandemic. So that's going to be the key.
Thank you, Cliff. Well, I'd like to thank our entire panel for taking the time to join us today, and thank you everyone for attending. If you do have additional questions or something you think of following the webinar, please feel free to reach out and we can get those questions out to the panelists for you. As noted earlier, the recording of this webinar will be provided to all attendees within a few days, so that will be provided to you. We do have some webinars coming up next week. It's a talent development series, helping your employees cope now and prepare for the future. And also more COVID-19 best practice. April 17th, how to keep your employees safe during the COVID-19 pandemic. What do you do if you find out one of your employees is affected? How do you manage your facility and keep your other employees safe? So that's coming up next week. Again, we thank you all for attending today. And like I said, if you have any questions, feel free to reach out to BAMA, reach out to Florida Makes, the Manufacturing Supply Chain Alliance. We are here and available to help you. That's what we're here for. As you do exit the webinar, we ask that you please complete the survey. We're seeking your feedback about how to improve these webinars and better meet your needs with topics of value to you. So thank you for taking the time today. Stay safe, stay healthy, and have a wonderful weekend. Thank you.